Hi everyone, this video is about chapter 34, lesson 4, fertilization and development. This is a continuation of our lesson. This is found in pages 995 to 998. Our objective is to identify the major events of later stages of development. So we'll now move on to the second trimester of the stages of the fetal development. So during the fourth, fifth, and sixth months after fertilization, the tissues of the fetus become more complex and specialized and begin to function. The fetal heart becomes large enough so that it can be heard with the stethoscope. The bone continues to replace the cartilage that forms the early skeleton. A layer of soft hair grows over the skin of the fetus, and the mother begins to feel the fetus movement. Transparent skin also has formed, and now the baby can open its eyes. Now on the third trimester, that is on the 7th to 9th month, so during this last 3 months before birth, the organ systems of the fetus mature and the fetus grows in size and mass. The fetus double in mass, and the lungs and other organs undergo a series of changes that prepare them for life outside the uterus. The fetus is now able to regulate its body temperature, and the central nervous system and lungs complete their development. On average, it takes 9 months for a fetus to develop fully, but babies born before 8 months of development are called premature babies and often have severe breathing problems because of incomplete lung development, although they can already live outside the uterus or outside the mother's womb. Yet there may be, of course, health problems or health issues. So during childbirth, a complex set of factors triggers the birth process. One of these factors is the release of the hormone oxytocin from the mother's posterior pituitary gland. Oxytocin affects the growth of large involuntary muscles in the uterine wall. As these muscles are stimulated, they begin a series of rhythmic contractions known as labor. This oxytocin is a hormone that stimulates the uterine walls to contract, forcing the baby out through the vagina. So as labor progresses, the contractions become more frequent and more powerful. So it's quite painful. It is really very painful. So the opening of the cervix expands until it is large enough for the head of the baby to pass through. At some point, the amniotic sac breaks and the fluid it contains rushes out of the vagina. And these contractions of the uterus force the baby, usually head first, out through the vagina. So as the baby meets the outside world, he or she may begin to cough or cry, so a process that rids the lungs of a fluid. Then breathing starts almost immediately and the blood supply to the placenta begins to dry up. So in a final series of uterine contraction, the placenta and the empty amniotic sac are expelled from the uterus as the afterbirth. Then the umbilical cord is clamped and cut, leaving a small piece attached to the baby that will soon dry and fall off, leaving a scar known as the navel, or its more familiar term, the belly button. Within a few hours after birth, the pituitary hormone prolactin stimulates the production of milk in the mother's breasts. The nutrients present in that milk contain everything the baby needs for growth and development during the first few months of life. Now, for infant and maternal health. Although the placenta acts as a barrier to many harmful or disease-causing agents, some do pass through this barrier and affect the health of the embryo. Like the virus that causes AIDS can affect the developing fetus, and the virus responsible for rubella, which is German measles, can cause also birth defects. Alcohol, drugs, smoking can cause as well birth defects and birth problems. Alcohol can permanently injure the nervous system, and drugs such as heroin and cocaine can cause drug addiction in newborn babies. Smoking during pregnancy can double the risk of low weight at birth, leading to other severe health problems. So it is important for maternal or for mothers to keep themselves healthy during pregnancy. So from 1970 to 2000, the infant mortality rate in the United States decreased by about 65%. Many factors contributed to this decrease. For example, in 1993, the U.S. Public Health Service recommended that women consume 4 milligrams of folic acid per day. If you're going to look at the graph, between 1996 and 1998, manufacturers of enriched grain products began to add folic acid to their products, which affected the incidence of spina bifida. So the graph shows here from the year 1992 to 2004, the rate of the rate of spina bifida cases from 1992 to 2004. Spina bifida is when a baby's spine and spinal cord don't develop properly in the womb, causing a gap in the spine. Spina bifida is a type of neural tube defect. This neural tube is the structure that eventually develops into the baby's brain and spinal cord. So it is important for mothers to take folic acid supplement during pregnancy, especially on the first trimester, wherein the brain is starting to develop. So let us now summarize the lesson. On later development, of course, another 6 months of development occurs during birth. During the 4th to 6th months, the fetus's tissue becomes specialized and organs such as the heart begin to function, while during the 7th to 9th months, the fetus's organ systems mature as the fetus grows in size and mass. The lungs and the central nervous system complete their development. Childbirth occurs about 9 months after fertilization, when hormones cause contractions in the mother's uterus. The contractions first push the baby out through the vagina. Then more contractions expel the placenta and amniotic sac from the uterus. Shortly after birth, the mother's breast tissues begins to produce milk that contains everything the baby needs for the first months of life. The placenta is a barrier to many harmful agents, but some are able to pass through it, such as viruses that cause AIDS and German measles. Alcohol, drugs, and smoking also have negative effects on embryos and fetuses. Prenatal care and advancement in medical technology have lowered the infant mortality rate. So let us now have some lesson check questions. List developments that occur in the fetus during months of 4th to 6th and months 7th to 9. So on the months of 4th to 6th, bone replaces cartilage, soft hair grows over the skin, the heart can be heard with a stethoscope, while on the 7th to 9th months, organ systems mature, the fetus doubles in mass, lungs and other organs are prepared for life outside the uterus. What is oxytocin and what is its role in childbirth? That's for our second question. The answer is oxytocin is a hormone that stimulates the uterine walls to contract, forcing the baby out through the vagina. So that ends this video. Thank you for watching. Have a nice day.